My name is Rakesh Popat and I'm a haematologist working at University College Hospital in London. At EHA this year, I'm presenting a poster looking at the DREAMM-6 phase 1/2 clinical trial for patients with relapsed and refractory multiple myeloma. It's my pleasure to give you a brief summary of this topic. So the DREAMM-6 clinical trial reports data for belantamab mafodotin in patients with relapsed and refractory multiple myeloma. The initial monotherapy results have already been published, and that's the DREAMM-2 clinical trial, which demonstrates a single agent response rate in the region of 20 to 25% and a median duration of response at the recommended dose at around 11 months. So the next logical step forward is to start combining belamaf with standard of care agents, and that's really what the DREAMM-6 clinical trial is all about. Part A is looking at combining belamaf with Revlimid and dexamethasone, and Part B is looking at combining it with bortezomib and dexamethasone. So this was a phase 1 and 2 clinical trial looking at various different doses of belamaf in combination with standard of care agents. Part A was looking at the combination with Revlimid and dexamethasone, and Part B was looking at the combination of bortezomib and dexamethasone. And in this presentation, we're really focusing on Part B results, as this is where we have the most mature data. So this trial was looking at patients who had at least one prior line of therapy. Importantly, they could enter into the clinical study even if they were refractory to previous Revlimid or indeed bortezomib. We're presenting the results of the 2.5 milligrams per kilogram belamaf dosing, although we are also looking at 3.4 milligrams per meter squared and also additionally at split dosing. But it's the data at 2.5 which is the most mature. To date, we've treated 18 patients. They have a median of 3 prior lines of therapy, and about 40% had more than 4 prior lines of therapy. The median age and demographics is otherwise as you'd expect, with an ECOG performance status of between 0 to 2. In this cohort, in terms of toxicity, I think that most patients tolerated the treatment combination fairly well. In terms of the adverse events of special interest, really what we're looking at are infusion-related reactions, and this is very similar to the phase 2 results, where only a small number of patients achieved grade 1 or grade 2 infusion-related reactions. And of note, just to remind you, with belamaf dosing, there is no mandatory pre-infusion prophylaxis required. Otherwise, the other key adverse events to mention are thrombocytopenia, and this was seen in a large number of patients, predominantly grade 3 and grade 4, really due to the overlapping toxicities that we see with belamaf and bortezomib. Nevertheless, this was manageable with dose interruption and modification. The other main toxicity is that of ocular events, which is known as keratopathy. Again, it was very similar to what we saw in the phase 2 clinical trial. All patients had some degree of keratopathy, and it was predominantly grade 2 and grade 3. No grade 4 events were noted, and we didn't have to interrupt permanently belamaf dosing at all for any patients. So again, this toxicity was managed with dose interruption and dose modification throughout. This treatment was well tolerated, and the response rates overall were 78%, with 50% of patients achieving a very good partial response. So I think in this small group of relapsed and refractory patients, it was nice to see quite deep responses occurring. We don't have data for the durability or progression-free survival as yet, as the data is still fairly immature. So in summary, this is preliminary data looking at the first 18 patients being treated with belantamab mafodotin or belamaf in combination with bortezomib and dexamethasone. The treatment appears to be fairly well tolerated. The safety signals is really what we've expected to see for those two drugs previously. Response rates are encouraging, 78%, just to benchmark with what we would expect to see in this setting. With bortezomib and dexamethasone, response rates have been reported in the region of 50 to 63%. So 78% is quite encouraging, particularly with a VGPR rate of 50%. So this trial is continuing, and we hope to be reporting additional data for the bortezomib arm and indeed the Revlimid arm later on as we go along.